So let's discuss the APGAR scoring. APGAR scoring, actually it is the numerical assessment of a child. It is the numerical assessment of child. So what are the components of APGAR scoring? So there are 5 components of APGAR scoring, that is A, P, G, A and R, where A stands for the appearance, A stands for appearance, P stands for, that is pulse rate, R heart rate, G stands for Grimace, A means activity of a child, and R stands for respiratory efforts. So in the APGAR scoring there are 5 components of this scoring, that is appearance of a child, while P for pulse rate of a child, G for grimace, grimace means the facial expression of a child, or we will assess it by doing stimulation to the child. Also A stands for activity, activity means the body movement of the child or the tone of the child, while R for respiratory efforts. And it is very important that in the respiratory efforts we will assessing the rhythm of respiratory efforts, and but we are not going to assess the rate of respiratory efforts. So in the respiratory efforts we will be assessing the rhythm in a child. Now actually in APGAR scoring it is discovered by Dr. Virginia APGAR in 1952, who was actually an anesthetist, and actually the Dr. Virginia APGAR it discovered this scoring for the numerical assessment on a child. Now in the APGAR scoring the minimum value, the minimum number, that is 0. In the APGAR scoring the minimum number is 0 while the maximum number is 10. So 0 is the minimum value, it is the minimum number, while 10 is the maximum number. So like here it will be in a range of 0 to 10. So it means the higher the number of APGAR scoring will show us that the child has a good health overall. But if the number is low, so it will show us a worse condition of a child. So the higher number, the 10 number, it will show us the best condition of a child, while 0 number will show us a worse condition of a child, while in between 0 and 10 will show us a moderate condition of a child. And it is also very important that in the APGAR scoring it will through the components of APGAR scoring we can actually comment on the vital organ of the body of a child. So as you know that what are the vital organs, that is heart, brain and lungs. So through the components of APGAR scoring we can comment on vital organ of heart, brain and lungs. Like if we see the appearance of a child, so it will show us the heart, assessment of the heart and lung. Pulse rate will show us a assessment of a heart, while the grimace and activity it will show us a brain assessment, while the respiratory efforts it will show us a assessment of a lung in a child. So in a nutshell we can say that through the components of APGAR scoring we can comment on the vital organs in a child. So it is important. Now let's discuss the scoring of APGAR score, that how actually it is distributed. So the minimum number is 0 while the maximum number is 10. Now let's say we have a different components, as I told you earlier, that is A, P, G, A and R. While let's suppose we have a three numbers, that is 0, here that is 1, and here it is 2. So with respect to different components, we assess it by different numbering, that is 0, 1, 2. So 2 will assess as the best condition of a child, while 0 will assess the worst condition of a child, while 1 will show us a intermediate or relatively good or bad condition of a child. Now let's say first focusing upon the appearance of a child. So A stands for appearance. So here it means that we will assess the skin color of a child. So as the baby birth occur, so if the skin of baby is pink, if the baby skin is pink, so that will be a best condition of a child, means the child is healthy, the baby is healthy. That's why we put the pink in a 2, in a alphabet 2, sorry, in a numbering 2. So it means that the condition of the baby is best. But if the child is blue, so it means the child condition is very bad, and that is the worst condition of a child. So here we will put it in a 0. So pink will show us a good condition of a child, blue skin of baby will show us a bad condition of a child. So let's say if we have a baby and that is the color of the baby is blue. So in one, the baby is blue, here there is blue body of baby, but sorry, there is pink body of baby, but extremities are blue. Extremities are blue. So if a child, just after the birth, if a child has a pink color, it means that is best condition of a child, so we put it in a 2. If the child condition is bad, we will that is blue, so that is worst condition of a child, we will put it in a 0. But if a child body is pink but the extremities are blue, so it means that it is the relatively condition of a child, like it's some of it could be dangerous as well, and it could be managed as well. So here we will keep it in 1. And why it is so, why the body is pink and the extremities are blue, that is because of hypothermia, and that is because of temperature difference. Like if a baby is a womb of mother, so here there is a 37 degrees centigrade, but as soon as when the child is delivered, so there will be, let's say if there is atmospheric difference occur, so because of that the hypothermia occur in baby. So in that very condition there could be a case of death as well. So let's come toward the P. So in a P there is pulse rate. So if the pulse rate is more than 100 beats per minute, it means the child condition is best. So we will, if the child condition is best, so there will be, we will put here and 2. So that is more than 100 beats per minute. But if the unassessing, if the child heart rate is absent, so that is the worst condition of a child. So here in a 0 the pulse rate is absent, while in a 1 the child condition, the child pulse rate is less than 100 beat per minute, like it could be 90, it could be 80 as well. So this is important. Secondly, there is a grimace. So what is grimace? Grimace means the facial expression of a child. Actually we can assess the grimace by doing the electrical stimulation to a child, and we will electrically stimulate the side of the leg of the baby, and upon stimulation we will be assessing the cry of a child. If the child cry is active, if the baby is actively cry, it means that the baby condition is healthy and it is normal. If the baby is not able to cry, it means there is some pathology associated with it. So upon stimulation, if baby is actively crying, so that is the best condition. So here there will be active cry or there will be less T cry. It is also called as less T cry. But upon giving electrical stimulation, if baby show no response, so that will be a worse condition. Here there will be no response. If there is a mild response shown by the baby or mild cry shown by the baby, so that will be an intermediate condition. So here there will be mild grimace. Now, A stands for the activity. So activity means the body movement of the child, like it is associated with the tone, the muscle tone of a child. So in activity, if the baby after birth, if baby show adequate contractions, adequate movement of the body, so it means that is the best condition. And two, there will be a good complexion, there will be good flexion with body movement. So if there is adequate amount of body movements, so that will be the good condition of a child. If the condition is atonic or areflexic, so that will be the worst condition. So here the body is flaccid. So there is flaccid body. Flaccid body means that the muscle tone is decreases, the reflexes is decreases. So there will be areflexic condition, there will be atonic condition. And in between here, there will be some flexion shown by baby. Now coming toward the last component of the APGAR scoring, that is respiratory efforts. So in the respiratory efforts, as I discussed earlier, in the respiratory efforts we will be more focusing on the rhythm of a child rather than rate of a child. Now in the respiratory efforts, if the rhythm is regular, so that will be the best condition for a that will be the best condition for a child. If there is irregular pattern, so that will be the worst condition. So in the respiratory efforts, if the rhythm is regular, so that will be best condition. And if the rhythm is actually absent, so that will be the worst condition. And if there is irregular rhythm, so that will be an intermediate condition, irregular rhythm. So this is all about the APGAR scoring. I repeat, APGAR scoring have 5 components: appearance, pulse rate, grimace, activity, respiratory efforts. If a condition is good related to different components, so we will be dividing those upon by giving numbering, that is 0, 1, 2. While 0 will show us a worst condition, 1 will show us an intermediate condition, while good will show us a best condition. So if the child has a pink appearance, so that will be showing the good condition. If there is blue condition, it will show us a worse condition. And if the body is pink and relatively extremities are blue, that will be the intermediate condition. And a pulse rate, if the pulse rate is more than 100 beat per minute, that will be the good condition. If the pulse rate is less than 100 beat per minute, that will be the intermediate condition. And the grimace, if they show no response, that will be 0. If show mild grimace, it will be in category of 1. If there is actively cry or less cry, that will be in a 2. Now in activity, if the child show flaccid body, that will be in a worse condition. If there is some flexion, it will be showing the moderate condition. If there is actively body movement, that will be a good condition. And in respiratory efforts, if there is a regular rhythm, that will be the best condition or best condition. And if there is irregular rhythm, that will be the intermediate condition. If there is no any rhythm assisted, so it will show us a worse condition. So that's all about the APGAR scoring. Now there are actually when we do actually APGAR scoring, So it is very important. APGAR scoring actually it occurs in 3 times. Mostly it is done by 2 times, but still there are 3 times when we calculating the APGAR scoring. So when we do APGAR scoring done just after the birth of baby at 1 minute and at 5 minutes and 10 minutes. So this is important. APGAR scoring done in a baby after the birth of a baby in a 1 minute, 5 minutes and 10 minutes. Now how we will actually, here there are 3 readings comes, that is that is 0 to 3, 4 to 7 and 8 to 10. So the higher number of APGAR scoring will show us a mild condition, while the very low numbering of APGAR scoring will show us a severe condition. So if APGAR scoring is in range of 0 to 3, it will show us a severe condition. If it is in range of 4 to 7, it will show us a moderate condition. If it is in range of 8 to 10, it will show us a mild condition. So there it is a severe risk, here the baby is in moderate risk, here the baby is in mild risk. Now if there is a severe risk, so straight away, just most important, just do the neonatal resuscitation. So how you will assessing the baby here? By doing the neonatal assessment. Now if there is moderate condition, if the child is in moderate risk, and that the most important is that giving stimulation to baby, secondly oxygen administration is important, and suctioning is important. While if the condition is a mild, so here just do proper care, proper normal care to baby. So here there are 3 readings. If the APGAR scoring is in range of 0 to 3, here the baby is in severe risk. If the value comes in a range of 4 to 7, it will, here the baby is in moderate risk. If the value comes in 8 to 10, it will show us a more mild risk for the baby. So here we will be doing the neonatal resuscitation. If there is moderate risk, in that condition we will be giving further certain stimulation to baby. Oxygen administration is important, suctioning is important. But if the condition is mild, so in that case just normal care is important for the baby. So students, that's all about the APGAR scoring, and thank you so much.